Okay, so I'm very fortunate to have a fellow Pakistani with me today, and this lovely lady. She is beautiful. She is 30, not 30, I think maybe at the most 40 years old. So she looks very young. And at age 5, she had an unfortunate accident of a car rolling over her skull, believe it or not. Yep, she survived. Yep, she's still breathing. Yep, and she had obviously a bad scar, but it got fixed and it looks pretty good. But as you bring it down, if you follow it right there, as you get close into the medial canthus area, it gets to be wide and hypertrophic. So that's the problem, and that doesn't look good. So the goal is to minimize this whole scar. I don't think we want to do anything aggressive right here, sorry, over here. But for this, we need to definitely re-excise, make sure it becomes a fine line, and then treat the whole length of the scar with the resurface. That would be the plan. This is a tricky area, medial canthus, as you know, not easy. So I have to make sure I do something to avoid the opening of this area, and I certainly will. My plan is to use photo silk, the permanent suture, so there's no chance of the dermis separating from each other. And then down the road, I think if we need to do an Z-plasty or some other fancy stuff, we can. But I really don't want to, because our skin, my skin, which we share, it just doesn't heal with a lot of those fancy things. If you can avoid it and keep it simple, that is the best approach. So let's get started. Okay, so here what I did was, I first figured out the boundaries. So this was the lowest point, thank God not any lower. Otherwise this is a high area for webbing, so that's really pain in the neck. Widest portion, and then comes up to here, but even here there was some, atrophy, so I've included that as well. This is going to be tricky right there from here to here, because you don't want this to be pulled, you don't want this to be pulled. One of the key things is going to be a lot of undermining, and this way there is no stress on the skin closure right there. And the key will be to use the deeper layer right here to the deeper dermis in the nose, and just get them to stay together somehow for a long time. So I will be using photo silk for that reason, and then keep the fingers crossed, because this is a tricky area. The reason is this has a strong thick dermis, this does not. So we just gotta make sure maybe we can get enough bites to hold it together, and lots of undermining to make sure there is no tension, no stress. You got it, let's get started. So I did not remove the scar tissue underneath. The tendency is to let's remove it all. No. You need a little tissue underneath. Otherwise, if you are removing skin and the underlying strong, thick dermal scar tissue, you'll have a depression. So when you pull the edges over, there's a dead space. The dead space is then going to lead to either webbing or widening eventually. So you want to leave it there. It's like a good anchor underneath, and then you can hopefully get skin everted on top of it. So let me just show you if you come on over here. Take a look at this. So I'm going to point it out as well. So you see, the skin is gone. Skin I put away somewhere. Let me show you the skin. So this is the skin right there, right? Underneath the skin, there's scar tissue in the dermis, but not the full length. Right there. So there's some scar tissue right there, but I left it right here, a good amount. See this? Because we won't need the support underneath there, so when you bring the tissues over, there's some support. That's the reason behind it. So you don't want to completely take it all out. So let's get going.